My name is Roman Pfister. I'm Deputy Director of the Department of Cardiology here at the University Hospital in Cologne. I do percutaneous treatment of mitral and tricuspid valve for 8 years now with experience in several techniques. Regarding the maneuverability, I think there's quite a big step forward with the new precision system. We do have more control on the one side, and on the other, also more control through the stiffened sheath. So the responsiveness of our movements are improved. And with the implementation of the third stabilizer on the implant catheter, we can do clocking maneuvers as well as movements from septal to lateral at a well-controlled fashion. I personally have now experience on the first 6 cases with the PASCAL Precision System, and it completely confirmed what we expected regarding ease of use. I think it is several small steps with respect to the release of the device, with respect to the stabilization of the implant catheter. Usually we work without looking at the devices, so we look at the monitors and we usually know where our hands have to go. There are moments during the procedure which are pretty sensitive during the grasping process where you don't want to get your eyes off the monitor. With respect to responsiveness, I think the increased stiffness of the sheath was an important point. The great advantage of the Gen 1 was the maneuverability and steerability in all different planes within the heart, but we had to do it on the cost of some kind of slippery of the implant catheter, and this was improved with the implementation of the third stabilizer. So now we can very well controlled maneuver the device within the valve. So both regarding clocking and also regarding septolateral movements. This was sometimes a problem because due to overshooting movements, we tried to counterbalance this with counter maneuvers, and it was not always possible. And particularly in the tricuspid valve, it is very important to have a controlled movement, otherwise you get entangled within chordae or the leaflets. The point of controlled maneuvering is the most important one, because it could translate in the safety of the procedure and safety for the patient. So now we can, on a millimeter base, move the device within the valve. We can well-controlled push the leaflet from one side to the other. I think particularly in tricuspid position, we usually do an independent grasping, moving the device from the lateral to the septal side, and now we can do this very well controlled without losing the direction and optimize clocking on a very accurate way. We started now with 6 procedures, but I think I already feel very comfortable. The overall device is the same, but the maneuvering and steering steps improve, but it is so intuitive. I think there is not much of a problem when switching from generation 1 to the precision system.